Hello, my name is Ashley. I'm one of the cardiac transplant coordinators with the team here. You are looking at this video as you have already received your heart transplant, and we are working on getting you closer to home. You will hear us frequently talk about two things after transplant. One of them being your immune suppression medication in order to prevent rejection. And on the other side of that, we talk about preventing infection. So these are two of the most common things we see after transplant. First, you'll be started on immune suppression medication, and this helps your body accept your new heart. And then you'll also be started on a combination of antibiotic, antiviral, and antifungal medications in order to prevent any infection. I'll elaborate more on each of these in upcoming slides. I would like to highlight some key points about your immune suppression medications. Your immune suppression medication is given after transplant to weaken your immune system so that your body does not recognize your new heart as foreign. Most people enter transplant with a relatively healthy immune system. So since your immune system entering transplant is healthy, we will start you on higher doses of immune suppression early after transplant. And over time, these medication doses will be reduced. It is important to note that your immune suppression medications will be lifelong medications. An example of a common immune suppression regimen consists of tacrolimus, mycophenolate, and prednisone, but can certainly vary person to person. Rejection, or your body recognizing your heart as foreign, is not uncommon, and we see it frequently in the first year after transplant. So we biopsy frequently during this first year in order to monitor for rejection and to safely and rapidly wean your steroids. Once your prednisone is below 20 milligrams, we may also replace certain biopsies with a blood test called AlloMap. And this AlloMap blood test can help detect rejection. Here is the biopsy schedule that we use here at Mass General. So you've heard me mention rejection a few times in the last few slides. I wanted to talk a little bit more about that. So as we've already touched on, rejection is your immune system recognizing your new heart as foreign, but I do want to highlight that it is not unexpected after transplant, especially within this first year. If we do detect rejection on one of your biopsies, we will treat this with changes in your immune suppression medication. We can treat rejection either as an inpatient or outpatient, depending on the severity and the opinion of the attending physician. If we do bring you inpatient, we will treat you with IV steroids. Otherwise, we can treat you outpatient and use oral steroids or prednisone. In order to assess for clearance of this rejection, we will typically pull you in a little bit earlier for your next biopsy. In most cases, rejection is asymptomatic. If you were to be symptomatic, your symptoms of rejection could resemble that of heart failure or the flu, and can include symptoms such as fevers, aches and pains, nausea, vomiting, fatigue, shortness of breath, palpitations, swelling in your ankles or legs, weight gain, or low blood pressure. If you were to develop any of these symptoms, we want you to report those to us. What can you do to prevent rejection? The answer lies within taking your medications. It's really important for you to take your medications as prescribed at the same time each day. Never skip any medications or stop medications without discussing with your heart transplant team. We also want you to discuss starting any new medication, whether they be prescriptions or over-the-counter medications, as some of them may interact with your transplant medications. You need to let us know if you're having any difficulty taking your medications, and also let us know if you're having any troubles with vomiting or any diarrhea, as this can affect the absorption of your medications. Another thing to note is for general aches and pains, Tylenol is acceptable in most cases. though we do ask that you avoid any non-steroidal anti-inflammatory medications, which would include medications such as Motrin, Advil, and Aleve. As you are now on immune suppression medications, you are more at risk for infection. You will be started on a combination of antibiotic, antiviral, and antifungal medicines in order to prevent bacterial, viral, and fungal infections for the first few months after transplant. In some circumstances, you may remain on antibacterial medications lifelong to prevent infections. We recommend that you wear a mask anytime you leave your home and when you are coming into the hospital for your appointments. It is also best to avoid going to crowded public places like the grocery store if possible. And when able, we recommend having a family member or friend do the grocery shopping for you. We also ask that you avoid using public transportation and air travel for at least 6 months after transplant or until you are cleared by your team. In regards to food, your dietitian will elaborate a little bit more, but we do ask that you avoid drinking from wells or flowing streams and rivers. If you're dependent on well water, we ask that you either boil your water prior to drinking or rely on bottled water. We would also like you to avoid raw meat, fish, and shellfish. Avoid raw eggs and unpasteurized dairy products. Do not eat deli meat, as you have an increased risk for listeria. We ask that you avoid grapefruit juice for potential interaction with your medications. Please avoid soft and moldy cheeses, including brie, gorgonzola, Stilton, and blue cheeses. Please also avoid raw milk cheeses. Please do not garden in the first year after transplant due to increased risk of infection. You can garden after the first year of transplant if you wear gloves and a mask and wash your hands before and after gardening. In regards to pets, you can have dogs, cats, and fish in the home. We ask that you avoid cleaning the litter box if you have a cat, and please do not clean up cages, including those of birds, cats, or fish bowls. Please do not come into contact with birds or reptiles due to salmonella risk. Swimming in chlorinated pools is permissible once you are cleared to swim by your cardiac surgeon. You can swim in lakes or oceans with caution, and we advise showering after swimming and using water shoes. Do not enter any body of water with an open cut or wound. Jacuzzis and hot tubs must be avoided due to increased infectious risk. It is permissible to enter new building undergoing construction. We ask that you avoid old building constructions due to fungal and mold exposure. Please avoid damp basements and plumbing. Please avoid smoking marijuana due to increased risk for pulmonary fungal infections. If you do choose to use marijuana, edible marijuana is a safer alternative. We ask that you notify us if you use any form of marijuana because it can affect your tacrolimus levels. If you do choose to smoke marijuana, please heat treat or microwave marijuana to kill fungal spores. In general, we ask that you avoid vaccines for the first year after transplant. The one exception is the flu vaccine, which you can receive 3 months after transplant. All live vaccines are contraindicated after transplant. These include your measles, mumps, and rubella vaccine, yellow fever, and Zostavax. Please notify us if you have a fever that exceeds 100.5 degrees, productive cough, shortness of breath, nausea or vomiting, particularly if you cannot keep food down, fluids, or your medications. And please notify us if you notice any increased redness, swelling, or drainage from a wound. These are all infectious symptoms that are important to call about. There are several other important things to monitor after transplant. We ask that you keep a daily log of your blood pressure, heart rate, temperature, and weight. If you have steroid-induced diabetes, we also ask that you monitor your blood sugar. When you come in for your right heart cath and biopsy appointments, we'll routinely monitor your kidney and liver function. We will also check your cholesterol at least twice per year. Immunosuppressant medications can also put you at higher risk for certain types of cancer, particularly skin cancers and lymphoma. We ask that you notify us of any new lump or bump in your armpit or groin, and let us know if you experience fevers, chills, night sweats, or unintentional weight loss. It is important that you also establish care with a dermatologist for annual skin checks. We ask that you avoid peak sun hours, 10 a.m. to 2 p.m., and wear sunscreen at least SPF 50 each day. Additionally, prednisone, one of your immune suppression medications, increases your risk of osteopenia and osteoporosis, which is bone thinning or bone loss. And we recommend a bone density scan every few years to keep an eye on your bone density. Cardiac transplantation is a major surgery and requires many lifestyle changes. It is understanding if you feel overwhelmed, anxious, or are feeling many emotions after transplant. To add, you will also be on high doses of steroids, which can add to these emotions the first few months. Should you want to discuss any of these feelings after transplant, please let us know and we will provide you with resources and team members who can help you. When you leave the hospital and are discharged home, we ask that you continue to avoid lifting any more than 10 pounds for 8 weeks. We will let you know when you are cleared to lift this weight. We also ask that you do not drive until you're cleared by your transplant team, which will again be around the 8-week post-transplant mark. You may shower, but we do not want you to bathe or soak your incisions during these first few weeks to allow for healing of your incisions. We also ask that you continue to monitor, as previously mentioned, your daily blood pressures, heart rates, weight, and temperatures. And we'd like you to record your blood sugars. We will let you know if we'd like you to follow your blood sugars. Please record these in a log and bring them to your appointments. Again, please do not hesitate to reach out to us with any questions after discharge, as there can be a lot of information and changes that you may have questions about. During this first year after transplant, we ask that you plan for a biopsy for each visit that you intend to see us. When you come for your first outpatient visit and for any subsequent visit, we ask that you bring your medication sheet provided by your pharmacist. We also ask that you bring the log of your blood pressures, heart rates, temperatures, weights, and blood sugars. As you will be having a biopsy on the day of your visit, we ask that you do not eat anything after midnight, but you may drink clear liquids up until your visit with us on Yaqui 5. We ask that you take your tacrolimus 12 hours before your scheduled biopsy and bring the dose with you on the day of biopsy. Do not take your morning dose, but bring it with you, and we will instruct you to take it after your biopsy. We ask that you report to Yaqui 5, and you will have your visit with your transplant team, and then we will send you over to Blake 9 for your biopsy after the visit is complete. Once you finish your biopsy, you can return home, and we will call you the following day with results and your plan from there. We just went through a lot of information about your post-transplant planning. It is very normal to have questions after transplant, and we do not want you to hesitate to reach out to us. We also ask that you reach out to us with any concerns, any medical concerns that we had listed previously. To reach us during normal business hours, please call 617-724-1400, and you will speak with our admin assistants who will send us messages. If you have any questions or concerns after hours or on weekends, we ask that you call 617-726-9292. This will reach the page operator, and please ask them to call the heart transplant doctor on call. The heart transplant doctor who is covering will return your call. Finally, for non-urgent issues, We are happy to use Patient Gateway, and that is a great way to reach us with questions or needs or prescription refills.